the principle of dental radiography, it can be divided into two types, which is the 2D imaging and 3D imaging. So under the 2D imaging, it is the intraoral imaging and also extraoral imaging. Meanwhile, for the 3D imaging, it consists of the CBCT machine. So the basic principle for dental radiography is the X-ray production. So X-rays are produced when isolated electrons hit the tungsten target and emits X-rays. These X-rays will then exit the tube head and interact with the patient. So let's start with 2D imaging. Firstly is the intraoral. So intraoral imaging is when X-ray beam is directed to the image receptor placed in the patient's mouth. And there are three types of examination, which is periapical, interproximal, and occlusal examination. Next, for extraoral imaging, we have the OPG or orthopantomogram. So OPG uses the principle where the tube head and receptor move simultaneously in opposite direction at a rotation center. So in most machines, this rotation center changes, which allows the elliptical shapes or elliptical imaging of the average dental arches. Also, the movement of the X-ray tube and the receptor will generate a zone called the focal throw, where the dental arches need to be repositioned for us to obtain the sharpest image. So next, for the extraoral imaging, we have the cephalometry. So the principle of cephalometry is rather simple, where the patient's head is positioned in relation to the X-ray tube and the image receptor for us to obtain a true lateral image or a PA image. So lastly, for the 3D imaging, we have the CBCT, which stands for Cone Beam Computed Tomography. So as the name suggests, CBCT uses a cone-shaped beam. How does it acquire image? So in a single scan, the detector and the X-ray tube will rotate around the patient to acquire multiple images of the FOV or regions of interest selected beforehand.
Next, I will be discussing the process of image acquisition in dental radiography, which is essential for obtaining diagnostic images. So now let's explore the steps involved. The first step is selecting the appropriate imaging modality based on the diagnostic needs. So there are two types of imaging modality, which are intraoral and extraoral imaging. So for intraoral imaging, it provides a detailed view of specific teeth and their supporting structure. For example, it includes bite wings, periapical, and occlusal radiograph. As for extraoral imaging, it can capture a broader anatomical area such as the entire jaw or skull. For example, it includes a panoramic or cephalometric radiograph. So the choice of the imaging modality depends on the area being examined and the clinical objective. So once the modality is chosen, the next step is to prepare both the equipment and the patient. For equipment, the X-ray machine is calibrated and the exposure settings such as time, kilovoltage, and milliampere are adjusted according to the patient's size and the imaging modality. As for patient preparation, the patient needs to position correctly based on the type of radiograph being taken, and then they are instructed to remain still during the procedure to avoid motion artifact that could compromise the image quality. Moving on, I will discuss the two key image acquisition techniques used in dental imaging, which are intraoral and extraoral technique. So let's start with the intraoral technique first. So a small sensor film or phosphor plate is placed inside the patient's mouth, and then X-rays are directed at the area of interest from outside the mouth. So this method is commonly used for detailed imaging of individual teeth or specific areas. So for better detail, you guys can watch the video that I attached in this slide. So next is the extraoral technique. For extraoral technique, the patients need to stand or sit in front of the machines. Here, the X-ray source and detector move around the patient's head, capturing image for purposes such as panoramic or cephalometric imaging. So this approach provides a broader view, useful for diagnosing larger structures like jaw or entire dental arch. Continuing with exploration of dental imaging, let's discuss the three crucial aspects, which are radiation exposure, image capture, and image processing. So let's start with radiation exposure first. As for radiation exposure, the X-ray beam emits a controlled amount of radiation that passes through the patient's tissue. So this is carefully calibrated to minimize exposure while ensuring diagnostic quality. Next is the image capture. For image capture, there are two main methods, which are digital and film-based system. For digital, a digital sensor captures the X-ray and immediately converts them into an electronic image. For film-based, X-rays expose a film that undergoes a chemical processing in the dark room to produce the image. So, actually, each method has its strengths. With digital being faster and more environmental friendly, while film-based methods still see use in certain settings. So lastly is the image processing and analysis. Again, there are two approaches, which are digital and film-based. As for digital, the image can be enhanced using specialized software for better diagnosis. For example, we can adjust the contrast or the brightness. For film-based, it involves in examining the physical radiograph directly. So we need to print the radiograph to evaluate the image. So as we know now that the digital methods are now the standard in most clinics due to their flexibility and efficiency. So after all, together all these steps form the backbone of modern dental imaging that enable accurate diagnosis and effective treatment planning for the patient. Moving on to the next slide, which is about clinical application. So as we know that dental radiographs are crucial in diagnosing and managing various oral health conditions. So now let's take a closer look at their application. So firstly, dental radiographs are essential in endodontics, which they help study the inner part of the tooth or the dental pump. Radiographs guide root canal treatments by showing the root canal system to show any infections or abnormalities that need addressing. Next, radiographs are highly effective in detecting dental caries because they show the deterioration or decay under restoration or in between teeth that might not be visible during a clinical examination. So, this aids in early detection and timely interventions. So, another important application is the tumor detections because radiograph can assist in identifying signs of mouth cancer or other pathological conditions. So, early detection can lead to better treatment outcomes that highlight the importance of routine imaging. So, other than that, radiograph also useful in the field of dental implants. Why I say that? Because they help evaluate bone structure and density to determine whether the jaw can support an implant. So, imaging can ensure precise placement and long-term success of the procedure. Then lastly, radiographs are widely used in orthodontics, which they aid in planning tooth alignment and jaw corrections. Then we can use a cephalometric and panoramic image to provide a comprehensive view for proper diagnosis and treatment planning.
Now, let's discussing the basic component modalities part. Let's start with the intraoral radiography system, the most common modality used in dental practice. It consists of three primary components. First, the control panel serves as the system command center, housing the on-off switch, indicator light, exposure button, and control setting for time, kilovoltage, and milliampere. This adjustment ensures accurate and safe exposure for high-quality images. Second, the extension arm allows movement and positioning of the tube head while securely housing the electrical wire. The tube head is core component where X-rays are generated. It includes essential parts like the lead collimator, positioning indicating device, PID, metal housing, insulating oil, tube head seal, X-ray tube, transformer, and aluminium. Now, moving on to the extraoral modalities. There are three main type modalities, which is OPG, cephalometric unit, panoramic radiographic. OPG provide a comprehensive image of the dental arches using X-ray tube, rotating images receptor, biting tabs, and head clamps for proper cephalometric units feature an X-ray generator with collimated beam, cephalostat, aluminium filter, and optional grid to minimize scattered radiation. Lastly, cone beam computed tomography (CBCT) delivers detailed 3D imaging. It includes a gantry, a digital flat panel, detector, laser alignment for precision, and advanced reconstruction software for image processing. In conclusion, the combination of these components and modalities ensure dental professionals can capture precise diagnostic image to aid in effective treatment planning.
Dental radiography offers numerous advantages, particularly in early detection, treatment planning, and also advanced imaging. So for the first one is early detections of disease, such as hidden caries, is one of its most valuable benefits. These caries, which are not visible during regular visual examinations, can be identified using dental radiograph. Moreover, dental radiography helps in spotting pathology abnormalities before symptoms appear. By catching this issue earlier, patients can avoid the need for more extensive or invasive treatment later on. Additionally, dental radiograph plays a crucial role in treatment planning. It ensures precise placement of the implants by providing detailed maps of the bone density and also nerve locations. For root canal therapy, the imaging reveals the number, the length, and also shapes of the tooth roots. Orthodontic treatments also benefit significantly from dental radiograph, as cephalometric X-ray helps assess jaw alignment and growth patterns, while panoramic X-ray gives a comprehensive view of the tooth positions, eruption patterns. Finally, advancement in 3D imaging, particularly cone beam computed tomography (CBCT), have revolutionized the dental imaging. CBCT provides detailed three-dimensional images of the oral structure in a single scan. This reduces the need for multiple scans and also minimizing radiation exposure and enhance the diagnostic accuracy. It is especially useful for diagnosis complex conditions like impacted teeth or TMJ disorder, where precise data is critical for effective treatment. Despite its advantages, dental radiography comes with some limitations. One major challenge is patient cooperation. For instance, patients experiencing pain in their jaw or head may unintentionally move during the procedure, resulting in blurred image and necessitating to repeat scans. This issue is particularly common in children or patients with dental anxiety, who may struggle to remain still. Similarly, with the gag reflex, can make it difficult to properly position the intraoral sensor, further complicating the process. Another limitation arises in terms of the interpretations of 2D radiograph. Errors in beam positions or angulations can lead to image distortions or magnification issue, making diagnosis less reliable. Furthermore, small lesions, fractures, or other abnormalities may be overlooked due to the overlapping structure, especially in the posterior regions of the mouth. This makes it challenging to determine the exact locations of the impacted teeth or the proximity of the root tips to the vital nerve. Finally, the high cost of advanced imaging technologies such as digital system and CBCT poses a significant barrier. This device requires sophisticated engineering and also high-resolution detectors, which make them to be expensive to acquire and maintain. This can be a burden for patients with financial constraints or inadequate insurance coverage. Additionally, smaller detailed practice, or especially those in the rural area or unserved area, may not have the resource to invest in such systems, limiting access to advanced imaging capabilities like CBCT or any digital modalities. So now, let's have a look on the latest technology of this modality. So first is actually artificial intelligence. AI has transformed the dental radiography by introducing a machines that are learning algorithm capable of analyzing complex radiographic data with precision. Beyond diagnostic, AI supports early detections of oral cancer, precancerous lesions, and also subtle structural anomalies that may escape the human observations. By providing consistent, fatigue-free analysis and also integrating with the treatment simulations for implants or orthodontics, AI has become crucial in advanced dental care worldwide, especially in regions like United States and also Europe. Next is near-infrared imaging. NIRI offers a non-invasive radiation-free approach to dental diagnostic. This analogy uses near-infrared light to penetrate the enamels and reveal the structural details within the dentine, which is enabling the early detections of decay, cracks, and also enamel thinning. Unlike the traditional method, NIRI provides a comfortable and safe imaging alternative, which is suitable for frequent monitoring and also real-time diagnostic. It has gained widespread adoptions in advanced dental markets like Canada and also Germany for its ability to identify dental issues at their earliest stages.